during this pandemic, apart from COVID, all other diseases have taken up backseat, especially those which are chronic. One of the most badly hit is rheumatic disorders. Hospitals had all the focus on COVID. Patients were afraid to go to the hospitals. Lockdown reduced the possibility of commutation and strengthened the idea to defer the appointment with the rheumatologist. Final nail was the irrational use of painkillers and steroids, which gave some temporary relief but took away recovery in lieu. To discuss this, today we have with us Dr. Vishal Kaura Agarwal, a leading rheumatologist at BLK. She will be interviewed by Dr. Sunil Grover, a renowned family physician. Over to you, Dr. Sunil Grover.
Dr. Vishal, I would like to ask you, we have a patient of rheumatoid arthritis under treatment, and if that patient develops COVID, what are the changes in treatment that you would suggest or you follow in your practice?
Yeah. Very good question. Thank you. In patients of rheumatoid arthritis who are on disease-modifying drugs, so in the first viremic phase, the first 7 days, we generally stop methotrexate, as it has been seen in viremia, along with methotrexate, there may be leukopenia subsequently. So that is a general rule that if at all there is any viral infection, we skip 1 dose of methotrexate. For COVID, that is what we had been following, that after they contract COVID, or rather after vaccination also. So 1 week of skipping methotrexate is the rule. And if we see that patient is on other immunosuppressants, rather anti-inflammatory, we don't give too many immunosuppressants in rheumatoid, we stop that for 1 week. Then we can restart from 1 week onwards. That means in the second week, we can restart the disease-modifying drugs. Unless until the patient is having moderate COVID and is on antibiotics, and then there are 2 weeks of skipping of disease modifying drugs but in mild COVID, it's just 1 week of skipping of the DMARDs.
And that helps. Dr. Vishal, another question is that hydroxychloroquine has been a disease-modifying drug and a very favored drug. But now, what really is your take on this thing in this COVID era?
For COVID, last year, hydroxychloroquine became one of the very popular drugs for treatment and for prevention of COVID, as it was seen that it creates some basic environment in the cell which does not let the virus propagate. And we also saw that some of our patients, some of our rheumatoid patients who got COVID, they got very mild COVID in spite of many comorbidities which they were having, and they came out of it very easily. And all of us used for preventive weekly, but we have never seen any side effect of hydroxychloroquine we use in every rheumatoid patient. But it was the combination of azithromycin with hydroxychloroquine which seemed problematic because of the QTC prolongation. But subsequently, there were some studies which showed that there was hardly any effect of hydroxychloroquine. So it was withdrawn. But in our patients, in our rheumatoid patients, we continue giving hydroxychloroquine during viremic phase also.
Wonderful. You've seen any rheumatoid diseases flaring up this post-COVID period, in your experience, in your practice and all? And what all do you normally do for that?
Last year when COVID, in this time only, we saw that many patients improved because they were getting steroid. Those mild patients who did not get steroids, they also did well. Few of them, of course, flared up. But this time, what I have seen is that many patients who were rheumatoid or who had family history of rheumatoid are coming after a month with arthritis. Rather, after vaccination also, we have seen few patients who have flared up in rheumatoid arthritis. I have seen patients of psoriasis triggering into a psoriatic arthritis for the first time, which they were psoriatic patient of ours, had psoriasis, but never ever experienced pain. But post-COVID, he came with very severe oligoarthritis with a psoriatic pattern. So I have seen rheumatoid arthritis and psoriasis getting flared.
See, Dr. Vishal, during lockdown, as you know, supply of medicine due to whatever reasons. So obviously there was a gap in medicine supplied for the patient. What sort of gap is acceptable for a patient? 3 days, 4 days, a week? what would be this thing? ज़्यादा harm नहीं होता patient.
It is very, very relative. So there is no discrete answer for this. As some people, who are in remission and who go drug free for a month, they can sustain well, they can stay, pain free. But some of them, especially those who have, who had very high disease activity and with lot of drugs, maybe 3 or 4 DMARDs, they are controlled. If they don't get, they may have pain in 1 week also. So it is very relative. So, but what has happened, it's a very good question, because of dearth of medicines, or rather over drugging, or having a lot of painkillers instead of the disease modifying, and having a lot of steroids rather, because then the patient knows about it, and many of them just hogged on, every day for 6, 7, 8 months they had steroids. So what they come with, few of
Just steroid.
yeah, only steroids they had been taking. So many patients, of course, approached us for video consultations. So those patients stayed okay, but others, rheumatoid arthritis patients came with flares, and but then they say we were very okay during lockdown. Why? Because they were taking some painkillers or some steroids. Some patients, rather osteoarthritis patients, came with who were, early osteoarthritis. They were quite okay because they were not able to exercise and they did not have access to their medicines. They also came with flare, very bad knees they came with. So it has, lockdown really affected patients of rheumatic diseases. But I will not be able to say, who can, have, there is no discrete answer for what is the maximum number of.
Obviously, no exercise also, that must be playing a major role also. And as you said, steroids also, lots of steroids without other medicines, that aggravates the problem.
So unsupervised steroids really, troubled the patients. Many of them came with infections. Many of them came with UTIs. One patient came with foot ulcer, foot cellulitis. So these complications, which we always worried of, patients seem to experience, and then they came to us after the lockdown stopped.
Thank you so much, Dr. Vishal, for a brilliant presentation. It was very crisp, very informative, and I think it's going to help lots of doctors, lots of GPs. Thanks a lot for you. Wonderful presentation.
Thank you so much.
I want to thank both of you for putting up such a good session, such an informative session. And these things we do normally don't see in the practice. We only experience, and the experience is the most valuable thing. So thanks for sharing for your experience, Dr. Vishal, and sir, putting up right questions to the right person and in time. I thank you a lot.
Highly my pleasure. Thank you. I enjoyed it. Enjoyed this
Thank
session.
you so much, sir. Thank you.